Bado naendelea, bado najikaza nifike kule. Bila neema na rehema zako ningekuwa wapi mimi?
Ladies and gentlemen, in the 21st century, we live in a world regularly affected by emergencies. Simultaneously, we are witnessing an increase in the burden of non-communicable diseases, including but not limited to heart, diabetes, cancer, chronic lung diseases.
And I think today, apart from what we are doing as a launch of a strategy, I think we need to commit ourselves, because all of us in this room, we have a role to play. We do have a role to play.
Described by the UN Secretary General, Mr. Ban Ki-moon, as a public health emergency, the NCDCs are already the world-leading cause of death. The disease are estimated to be responsible for over 60% of the global mortality each year. 80% of these deaths occurring in low and middle income setting. Most of the time I wonder, when today some of us can afford and have those pumps, how many are not able to get even the basic gadget for them to even test their status in most of these communities.
A lot of time you hear about malaria, TB, HIV. Anybody here I'm sure has attended a training on HIV, TB and malaria. But what is killing our people? If a patient dies today of HIV, there must be a reason. Either they were not compliant or, I don't know, something. But what are they dying of? All the patients who die of HIV either way die of a stroke, or die of renal failure, or die of diabetes, or something. So it's high time we started integrating NCDs into these three platforms.
There's nobody, whether he's rich or poor, old or young, who can say that they have been, they have avoided this issue of NCDs. And that's why us as Kenyans, 42 million Kenyans, we have to join in, because nobody has been spared. We have diabetes in our families, we have cancer in our family, so there's nobody who can really stand up and say, that is not my problem. It is a problem for all of us.
My name is Colin Zinjera, and I'm a Kenyan rugby player. Actually, when I received the email from Dr. Kibasho here informing me that I've been nominated to be a Goodwill Ambassador for the NCD, I was actually honored and excited to be nominated, because personally I've lost my father-in-law through diabetes.
My name is Kambua Manundu Mathu. I'm really passionate about this because my father barely made the 70th mark. Very passionate about teaching people about living healthy. And I'm excited to follow in his legacy, to teach people, to teach young people how to be responsible citizens. And that also starts with taking care of ourselves, because we are the leaders of today, not tomorrow. And so change has to start now.
Even I, myself, am touched by NCDs. Both my parents are diabetic.
Both diabetic and hypertension, and I'm very passionate about this because I believe that we can do something about it.
My name is Lolani Galu. I work with Nation Media Group, and by extension I'm a founder of African Queen of Hearts to mitigate the effects of non-communicable diseases. I survived mild stroke 4 years ago, and then I started to ponder about non-communicable diseases and discovered that we have a lot of misconceptions about this.
My name is Sita Wafula, and I have epilepsy and bipolar, which is a mental health condition. And I run an organization and a free SMS line where we provide information and support for people living with epilepsy and mental health conditions.
Doesn't cost that much, but the diseases that we are trying to prevent will cost us an arm and a leg.
In 2011, when we were gearing towards the UN declaration, political declaration on NCDs, we had several meetings globally, and one of the key strategies that was formulated globally was the NCD Alliance Global. Many of our institutions are members of that NCD Alliance, and one of the strategies for the NCD Alliance was to facilitate the creation of national strategies and regional NCD strategies.
Those of you who think we have not changed, I think just think about your TV in the last 20 years. As they're becoming smaller, we ourselves are becoming bigger. Obesity is a big problem, and that has been 50 years. The DMS always use the example of when languages were developing in Africa around 1900. That is when diseases got their names. That time there was epilepsy, and epilepsy has a traditional name. That time there was cholera, there was whatever other diseases, infectious diseases. They had their names. But diseases like cancer, they were not there. So they were not given an African name. Think in your community, as the DMS says, cancer is called what? Kaja. It's not a Kikuyu name, it's not a Luo name, it's not a Kalenjin name. It's just an English name. These things have met us. Again, 50 years. Just 50 years. And all these things have changed.
50 years down, 50 years of independence is the new war we have. And we have to address it now.
The need for multi-sectoral approach to NCDs. This is not a disease where one sector works alone. We work with transport, we work with food and nutrition, agriculture, security, we need to bring everybody together. Physical activity is important, tobacco control, alcohol control, all these sectors are important, and therefore one institution, one ministry, one sector is not capable in providing all the necessary support towards managing NCDs.
If we came in numbers to this room, it's because we believe that we have a role to play, and we are going to play, from decision makers, from civil society, from researchers, from universities. So we are here because we believe that we have a role to play.